Alexandra da Silva has been pacing up and down for 4 hours since arriving at this maternity clinic in Recife, still bleeding from an apparent miscarriage.
We are human beings, not dogs. I'm here waiting for the benevolence, and I'm told there is no estimated time to see the doctor.
She is not alone. The entrance and waiting room to the clinic are full of women in labor who've yet to be admitted.
I'm here with my daughter, and they say there's no space available. I'm terrified. Can you see her there? She's suffering to give birth. What can we do? We have to go from one hospital to another by bus.
We're told upstairs women in labor are undergoing cervical examinations in chairs because there are not enough beds and equipment or doctors to cope with demand. The orthopedic wing of another hospital looks as though it were in a war zone. Patients packed into corridors, many forced to wait for a week for emergency surgery. All over northeastern Pernambuco state, public hospitals and clinics are collapsing due to lack of funds. What you see here is the result of years of mismanagement and accumulated debt on the municipal and state levels, compounded by the worst economic crisis in Brazil in decades. And it's a crisis that's impacting not only the public health sector here in Pernambuco, but in many of Brazil's largest states, including Rio de Janeiro. A public health emergency has been declared in Rio, where the state has run out of money to pay for doctors and nurses. And in Pernambuco, an epidemic of a dangerous new mosquito-borne virus called Zika has also prompted authorities to declare a public health emergency, which in fact already existed.
There are doctors, but the state doesn't hire them. There's a deficit of rooms and resources. People need to protest to demand their rights.
But given its own need to slash spending in the midst of a deep economic recession, the federal government argues it can only provide limited emergency funding to the states to alleviate the crisis. Back at the maternity ward, Tamiris Dutra can take no more, while others in less pain do their best to comfort her. Clearly shaken themselves as they yell for a doctor who doesn't arrive. Lucia Newman, Jazeera, Recife, Brazil.